She was the per-diem nurse that Lakeview Meridian staff hadn't bothered to learn the name of. The woman doctor. Hugh Sinclair pointed at when he needed someone to fetch a chart. The woman, Linda Gaunt, handed room 14's worst admission of the night, because it was technically within hospital policy to dump impossible cases on the temporary staff. They treated her like a body they'd rented for 12 hours. By 3 in the morning, when 2 FBI extraction teams were sealing every exit of the building, and the man in room 14 was zip-tied to the floor with a loaded syringe still in his jacket, the entire overnight staff of Lakeview Meridian Women's Center would understand exactly what they had been ignoring all night. Mira Weston arrived for her overnight per diem at 6:45 p.m. With her badge clipped to the chest pocket of her scrubs and a thermos of black coffee she knew would be gone by midnight. She had worked 3 shifts at Lakeview in the past 2 months, which was enough time to understand the social geography of the place, but not enough time to matter to anyone in it. Lakeview was a private obstetrics center on Chicago's north side, the kind of hospital where the recovery suites had recessed lightings and the windows overlooked the lake. The permanent nursing staff had collectively decided, in the unspoken way that institutional hierarchies always decide these things, that per diem nurses existed somewhere between the housekeeping crew and the IV tubing supply cart on the organizational ladder. You were there to absorb the overflow. You were not there to have opinions. Mira was 36 years old, and she had learned to live inside that particular invisibility without letting it bother her too much. She had spent 2 tours in places where invisibility was a tactical advantage. Kandahar, 2014. Aleppo, 2017. Staff Sergeant Weston, 68 Whiskey, Forward Surgical Team. The kind of assignment that meant you arrived at the casualty collection point before the dust had settled, and you kept people breathing in conditions that a civilian ER physician would have called incompatible with survival. She had carried more people than she could count now. She had lost some of them too, and the ones she'd lost had left something behind in her chest that didn't have a clinical name, only a weight. She had come back stateside after Aleppo and taken the per diem work because it was the only version of medicine that still felt manageable. Clock in, clock out, do the work directly in front of you. Don't form attachments to institutions that will eventually ask more than you have left to give. It was a smaller life than the one she'd had, but it was hers, and most nights it was enough. Linda Gaunt was standing at the central nurses' station when Mira came through the security doors, and she looked at Mira the way you'd look at a piece of furniture you hadn't ordered but were stuck with. "Weston," Gaunt said, not looking up from her clipboard. She had been charge nurse on the overnight shift for 18 years, and she wore that tenure the way some women wore a good coat, draped over her shoulders at all times, slightly too formal for the occasion. "You're on overflow, rooms 12, 14, and 17. 17 is postpartum, should be a quiet night. 12 is a cervical check, she'll probably go home by 9. Room 14 is a walk-in from this afternoon, 32 weeks, some spotting. Her name in the system is Sutton. What's her situation? Stable. Her husband's been in there all day, and the afternoon staff found him, particular. Particular how?" Gaunt finally looked up. She had the expression of a woman who had grown tired of answering questions from people she hadn't hired personally. "The kind of particular that made 2 of my permanent nurses prefer to be somewhere else. Midnight bag change on the IV, don't forget." She held out the chart folder. "That's yours." Mira took the folder. She read it at the nurse's station before she went in, the way she always did. Jane Sutton, 32 years old, 32 weeks gestation, singleton, vertex presentation, viable. Admitted for light vaginal spotting and maternal anxiety, both documented in the kind of clinical language that meant the admitting physician hadn't known what to do with her. Vitals on intake were unremarkable. The support person was listed as a husband. First name, Ivan. No last name. The intake note flagged it as a data entry issue. Mira looked at that line for a moment. Then she tucked the folder under her arm and went to meet her patient. Room 14 was quiet in a way that felt deliberate, not peaceful. Jane Sutton was sitting up in the bed, with the sheet pulled to her waist, and her eyes on the fetal monitor, tracking the readout with a focused attention that most 32-week patients didn't have. Her hair was dark brown and pulled back without much care. She was composed and exhausted in equal measure, the way people look when they have been holding themselves together through something the room is not supposed to know about. Mira's eyes moved through the room out of habit before they settled. She still did it every time she entered a new space. The left-to-right scan she'd never been able to unlearn. The man in the recliner in the corner stood when she came in. Mid-40s, broad through the shoulders, with the unhurried stillness of someone who had learned a long time ago that stillness was its own form of readiness. He nodded at Mira without smiling and sat back down. He had positioned himself with a clear sight line to the door. She noticed that. "Hi, I'm Mira. I'll be your nurse tonight." She snapped on a glove and moved to check the IV site at Jane's arm. "How are you feeling?" "Fine." Jane's eyes tracked her hands. "Are you the one changing my IV bag tonight?" "That's the plan, around midnight." Jane's voice dropped, barely moving her lips. "Only you. Don't let anyone else in here touch it." Mira looked at her. Jane's eyes were steady and deliberate. This was not anxiety. This was instruction. "Okay," Mira said, matching her tone. "Only me." On her way out, she lifted the IV bag from the pole and held it briefly against the light from the overheads. It was supposed to be lactated ringers, standard concentration, pharmacy cleared that afternoon. The fluid looked clear, but at the very bottom of the drip chamber there was something. Not a reflection, not a bubble. A faint amber shadow, the kind of discoloration that you would not see unless you were looking for it, and you would not look for it unless something in the room had already told you to. She set the bag back on the pole. She stood very still for 2 seconds. Then she went to find the attending physician. Dr. Hugh Sinclair was the overnight attending for obstetrics, and he treated that fact the way some men treated a military rank, as a permanent declaration of superiority that didn't require further demonstration. He was 51, silver-haired, and impeccably groomed in a way that required either a great deal of time or a great deal of money, and at Lakeview Meridian, it was usually both. His dress shoes on Mira's first shift had been Italian leather, narrow-toed, and worth approximately what she made in a week. She had noted them and filed them away. Shoes told you something about how a man thought about the people around him. She found him in the physician's workroom, typing notes with 2 fingers while a second-year resident named Connell stood nearby with the patient expression of someone waiting for permission to exist. "Dr. Sinclair," she said from the doorway, "I have a concern about the IV bag in room 14. He continued typing. "What about it?" "There's some discoloration in the drip chamber. I'd like to swap it early and send the original for lab analysis." He turned the chair around slowly. He looked at her the way men like Sinclair always looked at temporary staff. Not with malice exactly, but with a kind of administrative vacancy, the way you'd look at a form you hadn't filled out yet. You're the Per-Diem. Yes, Mira Weston. The bag was hung by permanent pharmacy staff after standard clearance this afternoon. He glanced at Connell as if confirming something. Discoloration in the chamber is a known artifact in this lighting. Rooms 12 through 16 have had the complaint before. Hang the midnight bag as charted. The patient specifically asked, as charted. He turned back to the screen. The conversation was over in the particular way that conversations with people like Sinclair were always over. Not because the question had been answered, but because he had stopped listening. Mira stood in the doorway for a moment longer than was comfortable. Then she walked back toward room 14, because staying close was the only move she had left right now. She spent the next 4 hours doing the rest of her work. Room 12 went home at 9:30. Room 17's new mother slept fitfully while Mira checked vitals at intervals, but she found reasons to pass room 14's door every 40 minutes. The Ivan problem stayed in the back of her mind the way unusual vitals stayed. Not urgent yet, but logged. At 11:40 p.m., the fetal heart rate monitor in room 14 alarmed. She was already in the hallway 3 doors down, and she moved fast. The strip was showing late decelerations, the baby's heart rate dropping in the contraction's wake, recovering slowly, then dropping again. The pattern was quiet and systematic, and it meant something was interfering with the blood supply between mother and child. Jane's blood pressure was up. Not alarmingly, not yet, but climbing in the deliberate way of something caused rather than coincidental. Then 138/90, then 142/94. By the time Mira had the cuff on, her fingers were pale, her nail beds blanched when pressed, and the color came back slowly, too slowly. Vasoconstriction, the kind that didn't come from stress. Mira lifted the IV bag off the pole and held it against the light. This time she could see it without squinting. The amber tint was unmistakable now. Distributed through the lower half of the bag, the concentration still low, but building toward the threshold where the clinical picture would become undeniable and also, by then, irreversible, an ergotamine derivative, or something in its family. A compound that would tighten the vessels feeding the placenta in slow increments, produce a picture of progressive fetal distress, and eventually cause an ischemic crisis that would document cleanly as a spontaneous placental abruption. The baby would be delivered stillborn, and every note in the chart would corroborate it. It was designed to look like medicine going wrong, not like murder. Mira pulled the bag off the pole. She set it on the counter. She reached for a clean bag of normal saline and began switching lines. "What are you doing?" Ivan said. She had been aware of him the whole time. The particular quality of stillness in the corner of the room that meant a person paying close attention to everything while appearing to pay attention to nothing. He was standing now. His right hand had moved to the inside of his jacket. Not toward a phone. His wrist angle was wrong for a phone. "Changing the IV bag," Mira said. Her voice came out flat and steady, which was not something she had to manufacture. The patient requested it. "The bag that's there is fine." "I disagree." He took 2 steps forward. She didn't move back. On the bed, Jane's hand traveled along the rail to the IV stand bracket. There was a recessed panel there that had looked like standard medical equipment hardware. Nothing anyone would notice, unless they knew what they were looking at. She pressed it. A device on the bedside table lit up with a slow red pulse. It had been sitting there all night, passing as a standard medical alert bracelet. "Pick it up," Jane said. Her voice was thin but precise. "Red mercury, room 14. Mira picked it up and pressed it to her ear. "Red mercury, room 14. This is Mira Weston, registered nurse on overnight shift. Your patient is showing vasoconstriction, progressive fetal distress, probable IV contamination with an ergotamine class compound. I've isolated the bag. The listed support person is uncooperative, and I assess him as an active threat to the patient." 3 seconds of silence. Then a voice, flat and without inflection. "Copy that, Weston. Administer IV labetalol for pressure management. Do not use magnesium. Interaction profile will accelerate the ischemic cascade. We are 4 minutes out. Contain the support person by whatever means available. Do not let anyone access the medication drawer." The line ended. Ivan had heard enough. He pulled his hand from his jacket. What he held was a syringe, capped, labeled in a way that would pass a cursory inspection. And he was already moving toward the bed with the unhurried precision of someone who had rehearsed this sequence many times. Mira stepped in front of him. She was not a large woman. She knew exactly how she registered to someone like Ivan. Per-Diem scrubs, no weapon, a bag of saline in her left hand. She watched his eyes recalibrate her as a minor inconvenience, and she watched the exact moment he decided she wasn't worth a second adjustment. He moved to go around her. She brought the IV pole up horizontal and put it across his chest with enough force behind it that it stopped him cold and took the air out of him in a single hard exhale. He recovered faster than she would have preferred. He grabbed her left wrist with one hand, the syringe still in the other. Mira didn't pull away. She stepped into the grip, forward and inside his reach, not back, dropped her weight onto her left foot, and applied pressure to the joint in a way that was not in any civilian nursing curriculum. It had been taught to her in a forward operating base gymnasium outside Kandahar by a special forces medic who had said, with the cheerful practicality of someone long past the theoretical, that in a high-threat medical environment, there would be moments when the most important thing you could do for a patient was make sure no one could get to them. Ivan went down, not theatrically, cleanly, his body going where physics demanded it go, the syringe skittering loose across the floor. The door opened before he hit the ground. They wore dark tactical gear with no visible agency insignia. Cleaner than police, quieter than military. 4 of them through the door in rapid sequence, and the one in front had already assessed the room before Mira had fully registered that they were inside it. Agent Sasha Brandt was 40 years old with dark, close-cropped hair and the kind of face that processed information faster than it spent expressions. She took in the full room in one pass. Jane in the bed, the fetal monitor still alarming, the contaminated IV bag on the counter, Ivan on the floor, and Mira standing with her back to the bed rail holding a partial bag of saline and looking like none of this was particularly surprising. 2 of Brandt's team moved to Ivan. Brandt went to the bedside first. "Sutton, you're covered. We have you." Jane closed her eyes and exhaled in a way that suggested she'd been holding her breath for longer than the last few minutes. Brandt straightened and looked at Mira. "Weston?" "Yes." She crouched by Rel, checked his jacket, and withdrew a second syringe, unlabeled, larger. She stood. Concentrated synthetic oxytocin, enough to induce complete uterine rupture at 32 weeks. She looked at the contaminated bag on the counter, then at Mira. "Walk me through what you found." Mira walked her through it. She was brief and exact. The discoloration in the drip chamber, the vasoconstrictive presentation, the late decels, her clinical assessment of the compound class. Brant listened without interrupting. When Mira finished, Brant was quiet for a moment, with the quality of quiet that meant she was thinking rather than waiting. What's your background? Army, Kandahar and Aleppo. Mos? 68 whiskey, forward surgical. Brant nodded once. She turned toward the door. Dr. Sinclair was in the hallway, having come running when the monitor alarm ran past the 2-minute mark, and he was saying something loudly about liability assessment and unauthorized personnel. Gaunt stood behind him with her clipboard at her chest. Brant walked to the door. "Doctor," she said, "step back from this room." Sinclair drew himself up. "I am the chief of obstetrics and this is my patient. You'll have access to your patient in approximately 30 minutes when she's been stabilized." Brant's voice was not loud. It didn't need to be. "Your choices right now are simple ones." Something in the quality of the offer made the calculation obvious. Sinclair stepped back. Gaunt, behind him, said nothing at all. The next 45 minutes belonged to Mira. She had worked under active fire. She had triaged mass casualties in a tent with no generator. She had maintained sterile technique in conditions that would disqualify a civilian operating room. Room 14, with federal agents moving at the edges of her peripheral vision, was, by comparison, an environment she could manage. She administered labetalol IV. The blood pressure began to ease. She called for continuous fetal monitoring and watched the strip normalize. Slowly at first, then with increasing steadiness as the contaminated fluid cleared from Jane's system and the vasoconstriction began to resolve. By 1 in the morning, the baby's heart rate was stable. By 1:45, the indication for delivery was still valid. 32 weeks, ongoing distress, better out than in, and Brant brought Sinclair back in to perform the cesarean. He scrubbed in without a word. He operated competently and without flourish, and he did not look at Mira while he worked. At 2:09 a.m., a premature but healthy girl was delivered under the warmer. She cried immediately, which in obstetrics was the most important sentence a new patient could say about herself. Jane Sutton turned her head toward the sound and cried in the quiet way of someone who has been carrying something that had no name and has just been allowed to set it down. Sinclair left after he closed. He didn't look back. Brant found Mira at the hallway sink at 2:45, washing her hands the long way. Sutton and the baby transfer to a secure medical facility in about an hour, Brant said. We've had people with her since this afternoon. The breach was in the pharmacy chain, a cloned access badge on an intern who'd been compromised 3 weeks before admission. We're still untangling it. She leaned against the wall. What I'm telling you is that we had 3 layers of protection on this patient, and none of them flagged what you flagged inside your first hour on shift. Mira turned off the tap. I changed the bag. That was the job. You noticed the bag. That was also the job. Brant reached into her jacket and produced a card. Matte black, no agency name, just a phone number in small numerals. We have 4 protected individuals currently in civilian medical facilities across the country. 0 medical liaisons with any kind of combat trauma background cleared to this access level. She held it out. You wouldn't be a per-diem anymore. The hours aren't better. The work is harder. But you'd stop being the person they hand the impossible room to and then try to forget about. Mira looked at the card. She thought about Aleppo, about the specific quality of the dark outside the surgical tent, after a mass casualty event, when the work was done and the adrenaline had metabolized, and there was nothing left but the particular silence of a place that had seen too much. She had come home from that silence and taken the smallest possible version of a nursing job because it felt like the only thing she could hold without breaking it. She thought about room 14, about the way Jane Sutton had pressed that device into reach and said 2 words to a stranger in a Per-Diem badge because she had assessed the room and decided that the temporary nurse was the only person in the building she could trust with her life. She took the card. "I'll think about it," she said. Brant's nod carried something in it that wasn't quite a smile but was in the vicinity of one. "Have a quiet rest of your shift, Weston." She turned and walked toward the elevator, and by the time the doors closed, she had already stopped being present. The nursing station at 3 a.m. was the kind of still that settles over a space after something has moved through it and gone. Chairs at odd angles, a spilled cup of pens on the counter, the fluorescents doing their unremarkable work overhead. Dr. Hugh Sinclair was at the workstation, writing his incident report, with the careful, deliberate handwriting of a man who understood that every word he set down was traveling somewhere important and arriving on record. His hair was still in place. His expensive shoes had a scuff along the left toe that hadn't been there at the beginning of the shift. There was a saline stain on his sleeve. Gaunt stood at the far end of the counter, looking at nothing in particular. Mira walked to the station. She picked up room 14's chart and wrote her documentation, time-stamped, precise, the kind of nursing note that reads clearly under scrutiny because it was written by someone who knew it would be scrutinized. Then she set the folder down and looked at Sinclair. He looked back at her the way people look at someone they've just recategorized. It was not a comfortable expression on him. "The post-op order set for room 14 needs a signature before the transfer," Mira said, "and the original IV bag from this evening has been retained as federal evidence. Make sure your incident notes reflect that accurately." Sinclair's jaw moved slightly. "I didn't know," he said. "When you came to me earlier, I didn't know what you were seeing." "I understand that," Mira said, "but I did." She picked up the next chart, room 17, postpartum, quiet night, straightforward, and walked back down the hallway. Behind her, she heard Gaunt exhale very slowly, the controlled sound of someone setting down something they'd been carrying longer than they should have. Mira didn't look back. There was a new mother in 17 who needed a feeding check, and the shift had another hour left in it, and the work directly in front of her was exactly as simple as it appeared. That had always been enough, and tonight it was something more.